Hi everybody, it's Adam here from AJR Counselling, Coaching and Consulting, and as we put out there yesterday, we were going to get on here today and have a chat about the COVID-19 virus. I'd like to introduce a colleague and a very good friend of mine, Dr Bhushan Joshi. Joshi?
Yeah,
Josh?
Joshi. Or Joshi.
I'm so used to calling you just Boo. So, and Boo, Dr Bhushan Joshi is emergency medical doctor. So he's on the front line and has seen many people with COVID-19 so far, haven't you?
I have.
So we thought we've had a few questions come through, and we know that there's a lot of anxiety out there around COVID-19, and of course I see a lot of children, so I've seen a rise in the anxiety levels of children as well. But we thought it would be a really good idea to get on here today and have a chat about what COVID-19 is and how it's transmitted, maybe some of the things that we can do to protect ourselves, and maybe some tips around reducing anxiety around it. So I guess, Boo, I'll let you start with what...
Yeah, thanks, Adam. So thanks again, Adam. The point of this thing between Adam and I, and we can repeat, I think, if there's a demand for it, was I just felt for my friends and family, I mean, not necessarily all the healthcare workers, because they get information given to them quite a lot, but particularly for people who are getting caught up in information from the media, the TV, and social media. So I just thought it'd be nice to hear from both of us, one person working on the front line, one person who deals with a lot of patients with anxiety on a regular basis. And so I thought it's quite a nice project to work on. I'll just introduce things a little bit. So, and we can take things from there. And people have sent in questions, and so maybe we'll just focus on the questions, because I know that this could otherwise overrun for quite a long time. What is COVID-19? Let's keep it really simple. It's a virus. It's a little bit like a respiratory virus that transmits from one person to another person. Why is it bad? Because the fatality rate or the complications or the death rate is a little bit higher, or quite a bit higher than flu. So everyone gets a little bit worried about that. Why is that useful? It's useful to be a little bit scared, I think, because fear makes people do things. And so if we are scared a little bit as a society, it means that we're going to be washing our hands, or it means that we stay indoors, or it means that we try and prevent the transmission. Now, too much fear, and I'll let Adam deal with this later, too much fear can also be really bad. So if you're already washing your hands and you're already staying indoors and you're already taking a lot of the precautions, your risk for getting it are lowered. And so therefore, getting more anxious won't necessarily help you. You're already doing what the intention of the fear was there for. Anyway, that's a side issue. We can come back to anxiety and things later. How is this virus transmitted was a kind of an interesting question. So a lot of the questions we get in the media, or I've been asked, is it airborne? So it's transmitted through cough, sneezing, touching your face, touching other people. So if I touch my face, I touch other things, the virus stays on there. It's droplet transmission, as far as we know. It's not airborne. So if I'm just breathing in a room, it's unlikely, it can, but it's unlikely that the virus will be spreading around in that room. And so a close contact, according to New South Wales guidelines, is currently that you're in the same room, there's no protective equipment, and you're around that person for about 15 minutes. And a slightly less close contact is somebody, or actually not even less, the same type of contact is somebody who is living with the same person. And so you're spending, the whole 24 hours, more than 2 to 24 hours with that person in the same room. Close contact meaning you're touching, faces touching, you're touching the same surfaces. So really this virus, in short, is spread by droplets. It's spread by touching your face, breathing, coughing, sneezing. Usually things get onto your hands, and then your hands touch other things indirectly, and then other people touch those things, and then you touch your face. And so once it touches your face, then it gets in, which is why hand hygiene is really important, because basically if you get it on your face, on your hands, and then before you go to the shops, you wash your hands, and then you go out, and then you come back from the shops and you wash your hands, realistically or ideally, not even ideally, wrong word, but most of the time you've got rid of what's on your hand. So if by any chance you touch your face again, it shouldn't really be going onto your face. So that's kind of how it's transmitted.
That's actually good. I'm glad you answered that question, because one of the questions that came in was that there was a rumor going around that the COVID-19 can remain airborne for around 8 hours.
Yeah.
Um,
So that's an interesting one. So it can turn airborne, and there are things that can make it turn airborne, but usually they're confined to the hospital. So someone like myself or my colleagues, if we're about to put somebody onto a ventilator, or if we're actually giving them medication like a nebulizer or something, then that can make the droplets aerosolized and then go around the room. But at the moment, in emergency departments, we would not be nebulizing people. And if we are putting them onto a ventilator, they put it on ventilators in separate areas of the hospital or the emergency department. So realistically, in society, that is something we shouldn't really be worried about. And healthcare workers are taking care of that within the hospital.
Yeah, and when you said nebulizing, I guess nebulizing is kind of like you're talking about like Ventolin and that sort
Yes.
of.
So usually it's treatment for asthma or someone with emphysema. And it's when you're putting a liquid and it aerosolizes that liquid. But in that process, it will also be aerosolizing the COVID-19. And so if you are currently using a nebulizer at home and there are people living with you at home, that would then be considered a high risk procedure, because then that is spreading it around and aerosolizing it around the house. So ergo, therefore, the contacts in your house would then have everything that you have.
Okay, that's interesting. That's interesting. One of the questions that came through was that somebody has just this person's just got back from a cruise, and he's had to self-isolate for 14 days. The question was, should I isolate another 14 days if I'm in the same room with someone later diagnosed with COVID-19?
Yeah, and so the simple answer to that is yes. We can go into who should isolate and who should not isolate. So ideally, everybody should be social distancing, because that is how the virus is going to stop the spread, and the government is accordingly introducing new measures to help that. And so we should regularly be hand washing or using alcohol gel regularly, meaning before you eat, before you go to the before and after you go to the bathroom, before you prepare food, before you touch your face, before you come in your house, before you leave the house. So very, very, very regular. Use hand cream if you need to, because I know even working from hospital, your hands will get crackly, and depending on what soap you're using. So that's really important. But who should isolate? So anybody with symptoms, and isolation is different from self-distancing. Isolation means you stay in your house. You do not leave your house. So that's what isolation means. So that'll be anyone with symptoms. So anyone with a temperature above 38, or anyone with any respiratory symptoms, meaning sore throat, cough, sneezing, difficulty breathing. Sometimes some COVID cases have had loose motions, or just feeling really fluey and muscle achy. So those people should definitely self-isolate. Now, who else? Anybody who is a close contact. So if you're living in the same household, unfortunately, you would also have to self-isolate. And the recommendation currently is 14 days, just so that we know that the virus will definitely be gone by then. We think it's gone by about 5 to 7 days, but this is precautionary because we're still learning about the virus. And I think there have been cases where it has been transmitted up to 14 days. So that's who should isolate. When should you go to the doctor? That's a question that somebody asked me. The answer is usually you won't need to go. If you've got a temperature and you're feeling a little bit rubbish, that's okay. If you're having breathing problems, that's when you want to see a doctor. So the rest of the time, I would manage this like a flu. I know there's a big tendency to reach out and say, oh, I feel really bad. I can't get out of bed. I had one of my cousin call me yesterday and said, I've got a temperature of 38 and I'm feeling a bit lousy. And I said, well, because I'm talking to you on the phone, this means you do not need to see a doctor. If you're in bed, you can't get out of bed, you are unable to get out, breathe, you have taken Panadol to try and reduce your temperature, you'll know. If you're feeling very sick, that's when you need to go to the hospital. So that's one question I've been asked. I guess following on and trying not to talk for too long, I had another question is who should get tested? So currently, and this is a bit, remaining non-political, currently this is who we're testing. We're testing anybody who has a temperature above 38 and has respiratory symptoms. or has something suspicious, so some kind of contact. So they've been on a cruise ship, or they've been on a flight and then they were told by the airline that someone sitting next to them had COVID, or they've actually got someone who's a known COVID case and they're living with them, or they've been in a cafe and they've been told that they've got a COVID case, or travel history. So look, essentially, at the moment, we're not treating everybody because it would overwhelm the system. I also am not sure whether we have the resources to test everybody. So the safe bet is, if you're unwell, you probably don't need to get tested, and you should assume that you have COVID. We should all assume, every single person should assume you have COVID. Why? Because your behaviors will change. So if I assume I have it, I will be trying my best not to give it to anyone.
I think what's confusing around this time of year too is that, it's that time of year where people start to get unwell anyway, like common colds and flu and everything, and that could raise the anxiety of people because with this virus hanging around, and it could be just the normal cold or a flu.
It could be. However, the likelihood currently is that it's still going to be COVID. And you're right, it will probably merge into the flu season. But I would hope that by then, which is hopefully 1 or 2 months' time, we're actually really, really good as a society with hand hygiene and distancing. Yeah. And I would hope that actually even the amount of flu that we see would be less than normal because the hand hygiene practices have increased.
Yeah. Yeah, I was thinking the same thing actually. I mean, from our perspective, from AJR Counselling, Coaching, Consulting's perspective, we've gone to complete online session or phone sessions, and that's not because we think we're at risk or anything, but we want to protect our clients and our staff as well. And just doing that will help decrease the spread of the virus anyway. Yes. I guess one of the questions that did come in that I thought was quite a good one. So, a lady by the name of Diane, she's a grandmother, and she said that her daughter is living in a complex where there's been a family of 4 that were diagnosed as positive COVID-19, and she's worried about her daughter and the children contracting it. The same lady also has a daughter who is in ICU, who works in ICU, in intensive care unit in one of the Sydney metropolitan hospitals. And she's also really worried about her. So her anxiety levels are quite high around it, and she's waking up in the morning quite teary. I wonder if there's, other than the things that you've already suggested, and I guess like we all know about the hand washing, the social distancing, and staying at home where we possibly can, what would be the likelihood of living in a complex with somebody that may have it? Like, I mean, you live in a complex yourself, don't you?
So I'll answer both. One, if you know a family's got it, they shouldn't be leaving the house anyway. And that is one of the only times that we know for sure, that wearing a mask can help stop the spread. Because those patients who have COVID, specifically if they're covering their mouth, then it hopefully is preventing the amount of droplets that are coming out of their mouth. So that's one. And those patients who are known COVID or who have a fever or respiratory problems, you should be isolating, not distancing. You should be isolating anyway. And so the rest of the tenants or people living in that accommodation space should not have an increased risk. Yeah. Where would the increased risk be? I guess common elevators, common doors. So, as you leave the house, you might be touching those things. But as long as you're hand washing after you enter the house, as long as that's the first thing you're doing, then you've broken the chain. You've removed, even if you did get COVID-19 droplets on your hand, you will wash them off. So I would say to those people that I don't think there is any more increased risk just because you are living in those areas. Remember, it's not aerosolized. Those patients should be isolating anyway, so they shouldn't be entering and leaving the building. What about the mom who has an ICU daughter? So actually at work, we're pretty good with PPE. We are
PPE is personal protection, isn't it?
Yes. So this is equipment we use to prevent the virus getting to us as healthcare workers in the front line. So typically we'll be using gloves, aprons, tightly fitted masks. But we're actually trained quite extensively in that. When we finish our shift, we are trained in how to remove them safely, and we all shower at work before we leave work. And so actually the risk of us bringing anything home, provided that all the staff are following those guidelines and wearing the protection, is actually quite low. In fact, I would say that there's a higher risk for the ICU nurse to get it from their family.
Okay.
From coming home. So actually I would inverse it, and a lot of there's a few papers and research that I've been reading about what type of PPE is enough. Should we wear spacesuits and various things? But currently what we're doing is, in New South Wales guidelines, is enough and appropriate and safe for when the staff are leaving the hospital. And so when they leave, they are leaving as if they don't have the COVID. And therefore, the risk is actually somewhat higher when they actually go back into society. And so, the risk might be higher by the people that they're living with rather than the hospital, because in the hospital they're protected.
Okay. Interesting.
I'm happy to link that paper afterwards in there if people want to have a read about that. I did have another question which was really interesting from one of my friends from the UK, and they said, so if we all self-isolate now or distance now, what will happen in 8 months' time, and how are we going to get rid of this virus? Won't it re-emerge? So there's different ways of getting rid of the virus. Now, I'll just keep it really simple. One is there is we can look at Australia. It's an island. We have like X amount of cases, like 30 cases. We can all self-isolate and distance, and then hopefully it will burn out, i.e. no new cases every day for 14 days. Wow. That's quite hard to achieve because people are still going to be going out and doing things, and we will still be touching surfaces and we'll still be touching each other a little bit. So that could happen, but the amount of cases has to be like, we've got to flatten the curve and flatten it so much and stay indoors for 14 days that no new cases are found. So that's one. And then anyone new coming into the country will have to be screened and quarantined for 14 days every single time for about 6 months to a year. So that's quite extreme. That's one way. The other way is we get a vaccine. So, right, but we got to wait for that. The third way is we get some kind of immunity, but in a controlled manner. So this is where the whole stats and things with controlling the curve comes in. I.e., we allow patients in the population, like because of general community transmission, to get the virus. Hopefully they're younger people, so everyone who's old or immunocompromised or everybody else is staying at home anyway, so they're at lower risk. And so as people spread and become immune, the hospital services are not then saturated, that the patients who have COVID come to the hospital in a spread out manner over a few months. Now, how long that few months will go along will be determined by how many people have got the virus in an X amount of time. So the ideal will be that period is the shortest amount of time, but then with the most amount of young, healthy people becoming somewhat immune.
Yeah.
So that when the virus is still lingering around, if you're immune and there's like a population of 10 people and 8 people immune, it's very unlikely to then spread in the community. So that's all kind of epidemiological stuff. So the real answer is, will we be allowed it in 8 weeks' time? Won't it resurge? Yes, it might. But the hope is that there will be enough people that the spikes won't be as big. Or if it does reemerge, they'll recontrol and close society off for another 1 or 2 weeks and then let it open again and then recontrol. So it's just, that's what they talk about on the news, putting the brake paddles on and taking the brake paddles off, putting the brake paddles on, take the brake. And why are we doing that is because we don't want everyone to get sick all at once, so that you don't see someone like me all at once. And so that if you were to get sick, God forbid, we have a bed for you and a ventilator for you.
Yeah. Okay. I'm curious, Boo, what have you been doing for yourself to keep yourself mentally kind of okay through all this?
Interesting. So there's the mental question, but I'll answer the physical question, because another one of my friends said, what should I do? Shall I take supplements? So interesting. What am I doing? Look, back to old school stuff, what your grandma used to tell you. Why? Because doctors are not experts in telling you stuff about nutrition. I'm really good at telling you about disease and how to treat disease. I know a heart attack, I know how to treat it.
Yeah.
If you have a rash on your finger that you've had for 6 months, as an emergency doctor, I probably don't know what it is. And if you tell me, should I eat broccoli or spinach, I don't know, because I've not been trained in that. So look, balanced diet. I mean, what does that mean? But it basically means as long as you're eating enough of vitamins, minerals, fresh foods, vegetables, lots of fluid. You can take supplements, but I won't recommend, and I won't tell you what's good or not, if you feel your diet is not enough. But, usually if you're having a balanced diet, most things that you get will be enough from that diet. So that's the physical stuff. What am I personally taking? I'm taking a multivitamin.
Yeah.
Fine. And I'm drinking hot lemon because I like it, but not everybody has to do that. What am I doing for my own mental health? I'm loving having time on my own. I don't know if I'm necessarily an introvert or an extrovert. I don't really know, but I'm really enjoying. I can go to work and I come home, but I'm really enjoying just spending time by myself. And so, I can reach out to my friends on the phone, but I've really used this time to look back at what I need to do in my life. I've been studying. I've also been looking at my goals for the year. I've got a home. Bought a home exercise bar. And interestingly, over the past 7 days in the evenings, every day, I've been using apps like Calm. I've been doing their like gratitude exercises and things, which is amazing. I'm incredibly lucky. I've got a balcony, so I actually can sit outside and look at the sun. I realize not everybody will have those things. Now, self-distancing doesn't mean you can't go out. You can go out for a walk as long as you don't touch people or lick them or kiss them. Unfortunately, here's a great thing for the guy.
If you lick people when you're out, especially if you don't know them.
Okay, so a little snippet. I mean, I'm a gay man. For the gay community, it means grinder dates are out. You can't have a grinder date come home because that's close contact. And so if they have COVID, you will inevitably get COVID the minute you kiss them or touch them. And I guess that applies to the straight community too. Who can you go out with? I think this is, I think the government tells us this anyway, but anyone in your house you can go out with because you're already in close contact with them. Anybody who's not a household member will be considered an extra. And so ideally you should be limiting contact with those people. But yeah, back to the question, mental health. There's been studies, I can even put them up. There's studies to show that sleep is really, really, really good and really important, and actually boosts your immune system and helps you fight the virus, as well as eating and drinking better. And go for walks, sure, as long as you're eating or touching people. But that doesn't mean going to Messina and queuing up for ice cream, because that's not going for a walk. That's literally standing in a queue and there's lots of people in front of you, and your risk of giving it to other people is high. Everybody should assume that you have it. And the minute you assume you have it, then it'll change everything, because the way you behave around other people will change.
Yeah, absolutely. Absolutely. It's kind of interesting from my point of view as a mental health clinician and a coach, and mostly as a mental health clinician in this sense, I guess, is that we see a lot of people who have chronic mental illness, for instance, and they're already feeling isolated at home. And their appointments with us, sometimes I can think of 3 off the top of my head who come to their appointments every week simply just to have a chat and have that social time. And unfortunately, they're elderly as well, so they don't have access to like internet, or they probably do, but they don't know how to use it, or they have a home phone. So we've been doing a lot of phone calls with them. But it's that kind of connection that we have with people. As people, we like to be connected to others anyway. It's kind of interesting that these people who are feeling isolated now kind of almost in a way feel like they're being forced to isolate, are feeling the impacts even more. I
Yes.
guess.
Yes.
You know.
And that's where it's important, call your auntie or your grandma, or check in. And one way to do that, in particularly if you're living in flats or things, is put a little note under the door. Hello, I'm your neighbor. Do you need anything? How are you going? Here's my phone number. And there's a lot to be said about human connection, and I think distancing doesn't mean a lack of human connection.
Yeah, absolutely.
I really like, there is an Italian grandmother who it went viral on social media, and she says, now we should introduce ourselves, or not hug, but we should wink. And
Yeah.
wink across the road.
Yeah, wink.
Hello,
Yeah.
how are you? But
Yeah.
there's lots of interesting, fun things to be had, and there's lots of creative things that can come out of this. Remember, I really like the metaphor of remembering what fear is for. Fear is to drive us into action, into doing something. So the something is the washing the hands and the distancing. But if you've done that, you've listened to the message, and therefore you shouldn't let the fear of it take you over. There's lots of things we can control and lots of things we can't control. And if you've tried everything you can to not get the virus, you've done pretty good. If you then get it, it's unfortunate. Okay, it's unfortunate, but you can't prevent. You can't not leave your house because you're scared of getting run over, ever. Well, then you'd never leave your house. So there's different ways you can look at fear, and if you're trying everything you can anyway already to prevent you from getting it, you're probably doing all right.
Well, one of the things that I often say to people, especially when people present with anxiety, is that anxiety its positive intention is to protect us. And it's that protection response that we have, that flight or fight response. We either want to fight it or we want to run from it. And, simply kind of reframing some things like that anxiety is there just to protect me. You're right. It does get you to do things that you normally wouldn't do, or it helps you to be kind of a little bit more alert about what you can do to kind of keep yourself safe. It's kind of, I've had quite a few questions, especially from the parents of the children that I see. In particular, children who are on the spectrum, and that can be across a couple of different, the level 1, level 2, whatever it is, but their anxiety is real. And one of the questions I do get asked a lot is, how do I talk to my kids about this? Because they're so frightened about it.
Yes.
And I guess my suggestions around that is to, use age-appropriate language for children, and openly discuss things. If they come up with a question, just answer them and be honest. It's important to be honest with them. We don't want to be kind of down or dumbing down what this virus is doing, and the potential of us being able to self-isolate or social distance or whatever it is to help us lower that curve. But there's also really good things about this, like about being at home. If you're at home with your family, it gives you more time to be able to kind of be creative, spend some more time together. I know just in me being at home and working from home, it's made me think of some creative ways of actually delivering services. And it's been quite interesting. I'm trained in, EMDR, which is God, what is it again? I'm trying to think of the eye desensitization movement reprocessing, EDMR. I actually had one person with their partner doing the eye thing while I was actually testing as we went and doing the body scans and everything. So it's been creative.
I've got a
flexible.
Question. So I've got a question, because I guess most of my friends and family won't know what EMDR is. But example, I've got a friend, and she has messaged me and said, "Look, I'm just having trouble sleeping."
Yeah.
So what would you say to somebody like her?
Okay, that's actually a common one too. And actually Di, who says she wakes up, in the morning, it's the first thing she thinks of, where she starts to get teary. But going to bed and sleeping, usually it's worry. Often, and especially at this time, and this is just my thought around this, if you're at home and you're doing as much as what you normally do, your body probably doesn't need as much sleep. So sometimes just laying there and kind of accepting that and saying, you know what, my mind or my body doesn't really want to sleep, so I'm just going to rest anyway. Often you'll fall off to sleep. But if you've got thoughts that are rotating around in your mind all the time and it's consuming you and it's keeping you awake, maybe some mindfulness tips, some breathing exercises are really good. One of the things that we've got here actually that we give to our clients is called 4-7-8 breathing exercise. And one is just to breathe in for 4 seconds, hold your breath for 7 seconds, and breathe out slowly for 8 seconds. And what that does, it kind of activates the parasympathetic nervous system, and which is responsible for rest and digest. Yeah. And it helps lower your heart rate and relax those internal organs. So it's a really good way of actually being able to refocus and focus on your breath. That's one tip. The other thing is, especially with children, and one of the ones that I think work really well, is I often get kids to imagine that they've got an imaginary box. And the thought that comes to them, I say, maybe take that thought out, put it in the box, because there's not anything you're going to be able to do about it overnight. Put it in the box, put the lid on it, and then get it out in the morning. Often kids will forget it. They'll forget about it. But it actually gets them to do something and put it away. I
quite like that visual, you know. So
yeah.
It when you say to someone in meditation, you know, when you watch your thoughts, I get that is a similar process. But I also like that visuospatial thing, and I think a lot of people might need that to recognize, okay, I'm actually thinking quite a lot. Why don't I just watch what those things are, take it out of me, and so it becomes something external to you.
Yeah, and you can do that with feelings as well, with emotions, and you know, you can. Kids are great using their imagination, so use whatever tools they have to be able to do that. You know, the other one is some grounding exercises. So maybe, you know, stopping. I use this one quite a bit. Stop, which, you know, I imagine a stop sign. So the first letter is to stop. T is to take a breath. O is to just observe and see what's going around you. And P is to proceed. And what that does, it helps kind of reset your mind, because the mind and body are connected. Therefore, they affect each other. Yeah. So being able to interrupt that cycle a little bit is a good way of managing.
And I like that, because there's also the change of physical state. So if you're doing something and you move, the motion itself, you know, somebody, I think Tony Robbins, emotion is movement in motion or something like that. Or, I can't remember exactly what it says, but you know, if you are really worried or something, go for a walk, do something physical, because it takes you out of your mind and into your body, and hopefully you'll be able to understand or make sense of things a bit better. I just remembered we just had one more question, and it was really regarding masks. So this is a little bit controversial. Should people wear masks? So at the moment, in Australia, we're not recommending it. It is very good for someone who has COVID itself, so it spreads the droplet from spreading. I know that in Hong Kong and Singapore and other places that they've used masks for everybody, and I think it is a potentially good strategy, because it means that everybody is assumed to have it, and therefore you just reduce the spread. So I'm not against that, but it's just currently not recommended in Australia at the moment. And I imagine that may also be to do with supply. If you have a mask, should you wear it when you go out? Look, if you have one and you have lots and lots and lots and lots of stock, and you've been stockpiling and stealing and taking things away and all those things, please give it back to the hospital. But if you have just one or two and you're going to use them at home, then sure, just use them. Make sure when you put them off and take them off, you're only touching the back, because the front will be contaminated, because then you'll be retouching yourself. And that's probably all I was going to say really about masks. Is that the other good thing about the mask is it reminds you not to touch your face. So every time you're using mask, if you suddenly bring your finger towards your face, you touch your mask and you go, oh, sorry, I touched my face. So it reminds you, and then you go, oh, I touched my face. So actually having a mask on is a good reminder of not to touch your face. And also, if you wear a mask, because I've tried it when I went to Coles once and I've had no symptoms, everybody walks away from you.
Yeah.
So,
So you got the aisle free.
so it's fantastic because it reminds everybody we should be socially distancing.
Yeah.
So I'm not really going to enter the political debate or the debate about whether we wear a mask or not. But if you have one and you're leaving the house, sure, wear a mask. But I wouldn't necessarily bin them. I think we probably have a shortage. I'm talking about people who have no symptoms. If you have symptoms, you shouldn't be leaving the house anyway.
Yeah,
You should not leave the house at all, and at least until 14 days after the symptoms resolve. And if you're a close contact of that person, are you living in the same household, that rule applies to you too. Should those all people get tested? Not really. What is it going to do? Look at our numbers, and so we'll say, oh, you also have corona. But remember, by the time you leave the house, you would have increased your risk of infecting others. And when you get to the clinic, you'll be waiting in a queue with lots of other people who also have corona. So even if you didn't have corona, you're waiting in a queue in a clinic with lots of people who also have corona. So really, I'd probably avoid coming to hospital.
Yeah. Just before we finish up, because I think time's starting to get away from us a little bit, but I guess one of the things, the other question I've been asked by parents is, how do I communicate with my child about all this and reduce their anxiety? But the other thing I wanted to mention was if, because you mentioned it just a little while ago, and it's about managing your state. And I think as NLP practitioners, we know how to manage our state. But when you manage your physical state, it helps to manage your mental state as well. The reason I'm mentioning this if kids see their parents panicking, likelihood is that the child's going to start panicking too. So kind of managing your state and being calm, and maybe even think of a resourceful state that you've had before where you've done something where you felt confident or calm, and remember how you sat or how you stood or whatever, and just take that position, because that will actually change your internal state as well. So it's just another tip to help,
And I guess not just for kids, I think that translates to everybody.
Everybody, absolutely.
If you're standing tall and feel confident in yourself, then that confidence will go to others. And particularly in this time, it's nice to share that love and confidence and I guess feeling okay in yourself to others, and share it out, because I think we're in a time where we need it more than ever, and I agree with you, we've all been in a resourceful state when we've overcome challenges. This is just another challenge.
Right.
It's a societal challenge. We are in this together. It's absolutely correct, but also I also know that we'll get through this. I mean, and remembering that and keeping that at the back of your mind, I think for a lot of people, for the majority of society who will be asymptomatic and who just has to ride out being isolated or distanced, remembering that the end is coming, and that can be enough for some people.
That's right. There's I often ask the question to my clients, tell me one thing you've never gotten through. And if they do say something, I say, well, you haven't gotten through that yet. But everything you've gotten through.
I agree. A reframe. You haven't got through that yet, but everything in life, I believe, is here to shape you and make you a better person. And I think this is also part of that experience.
Yeah. Well, Bill, we're probably going to have to finish up now, but thanks so much for coming on and having a chat with me today. And it's been good to have a chat with each other, because I've learned a little bit as well, which is good.
Yeah, so have I.
But I guess you on the front line, thank you for all the hard work that you do, being in emergency, and I can imagine how busy that would be. And I wanted to let everybody know that AJR Counselling, Coaching, Consulting is still open for business. We are doing online sessions, and it's just as good as a face-to-face session. Look, we're in 2 different towns, and we can communicate like this. So your mental health is probably more important than ever at the moment, and so are your children. So thanks, Boo, for coming on. And
very nice. And hopefully I don't see any of you ever in the emergency department.
Yeah, true. Okay.
All right. Okay.
Everybody, take care. Have a great week. It's good to talk. And
we may repeat this, Adam and I, if we feel that there's a demand and that there's questions to be answered.
Yeah. What I was going to say too is just send us a question. If you have a question or something, please send it, adam@ajrcounselling.com.au, or you can text it to 0410930039, or just ask the question on Facebook if you like. We will get back to you and we'll try and answer as many as we can. We want to keep the channels open and provide as much information as we can for our clients, your patients, and the community as a whole, I guess.
Yeah. I will just snip in very quick. I forgotten a question that was answered by one of my colleagues. People who are making masks at home, or like, the new companies, or who are making masks really quick, should we use those? So I would say for healthcare staff, use the ones that are provided. And for the home ones, it depends on what kind of mask it is and whether it's protective or not. But as a minimum, it'll just remind you. It may not be that amazing protective barrier for you not to spread. Remember, it's not for you getting it, it's for you not to spread it. But again, having a mask, even if it's having a scarf even, is just a reminder for you not to touch your face, and so that if you cough, it gets absorbed into that. So that's what I would say to that, is that it depends on what kind of mask it is, whether you should be using that or not. But even if it's something, the use will be that it's a reminder not to touch your face. Okay, there you go.
No worries, dude. Take care. I'm sure we'll talk again soon.
Cool.
Anyway.
All right. See you. Bye.
All right. Take care, everybody. Bye.